June 13th, 1995, the date of my delivery at Florida Hospital. Most people are born into the hands of an obstetrician, and the rest of our lives preconditioned to trust our medical professionals instinctively. I no longer hold a naive approach of medicine after writing this speech. My father, a career-long CRNA, and my mother, a nurse practitioner over 15 years, both amid a turning of tides in their respective fields. Over the past 10 or so years, Johns Hopkins School of Medicine has conducted extensive research on deaths stemming from medical errors. Every day, people enter medical centers with the notion their provider is honest and educated. That being said, even educated professionals make mistakes. But these mistakes have converted into deaths, resulting in a new third most deadly disease, surpassing respiratory disease, deaths induced by medical error. The main points I'll discuss is the CDC, Center for Disease Control and Research conducted, medication errors, and then also causes and solutions for these problems. In plain English, the CDC nor hospitals across the United States have recorded these details correctly for decades. Through the conduction of my research on the topic of medical errors, I first wanted to start at the head of the snake, where medicine in the West essentially originated, Hopkins. Here is the opening of an article straight from hopkinsmedicine.org, the website, under News and Publications. The Johns Hopkins team says the CDC's way of collecting national health statistics fails to classify medical errors, specifically on death certificates. Not only were these records tainted and not disclosed as medical error, but since 1949, Dr. Martin Makary, professor of surgery at Hopkins, says the U.S. adopted an international form of billing, ICD, that used International Classification of Diseases billing codes to tally deaths. Over the span of more than 8 years, Johns Hopkins School of Medicine conducted extensive research analyzing and collecting data, medical death rate data. During this research, Johns Hopkins patients safety experts have calculated that more than 250,000 deaths per year are due to medical errors in the United States. Not only is this number staggering, but it is even more frightening considering how many of us are affected, including our friends and our family. One of the largest misconceptions in society is that medical errors resulting in death are merely down to surgery. There are countless deaths yearly due to ADE. What are some of the resulting factors behind ADE or adverse drug events, and what are some of the causes of these records? First, let us start with a concrete foundation where we understand what the definition of ADE is classified as. To clarify this definition, it is pulled from an article from PSN, Patient Safety Network. ADE is defined as harm experienced by a patient as a result of exposure to a medication. Clearly, the definition is any form of harm, accidental or malicious. These events vary drastically. For instance, one example from the Joint Commission website would be the opioid epidemic, which we declared a public health emergency in 2017, has also brought light to the role of clinician-specific and health system factors in medication errors, and this was found also on Agency for Healthcare Research and Quality. There are a multitude of people and systems intricately involved in the process of fabricating, dispensing, prescribing, and dosing. Just to put it simply, each portion of the process I delicately laid out for all of you to see are all operating individually and all have a mutual responsibility to the patients and care providers. The board members of these facilities need to take a deep look into their business and why they cannot commingle to lower the risk of potential ADE. Over the course of 50-some odd years, all of the incidents, misdiagnosis, and more will come out to be pinned on active medical professionals, which leaves the next generation to answer for these unfortunate circumstances. Better yet, I suggest what we could do as a society and the medical industry is find out what is causing these medical errors. What are some of the reasons we are encountering these problems today, and where is the root to the tree of medical errors? If you misdiagnose an illness, that's one thing. But to continue with the wrong treatment after reviewing a patient's analysis is what begs the question, who oversees these operations? After digging a little bit deeper, I stumbled upon the Joint Commission's website. This website included, but was not limited to, appropriate responses to misdiagnoses and medical error. When looking into many situations nowadays, your first stop is the IT department. This is where the hospital records are sent and received through encrypted programming and defense. After clearly identifying that the IT department's involvement, which could not be corroborated regardless, you implement preventative strategies. These strategies include active confirmation processes to help match the patient and documentation and follow a during the process evaluation type of system. My hopes are for enlightening my fellow peers and to simply just educate on the matter of medical errors. Throughout this paper, I have highlighted major points across medical error research, programs, and sources. Through this, I have gained a tad more understanding that whilst not a perfect world, we must always strive for perfection in this field. In conclusion, the CDC and also Hopkins University and other ubiquitous valiant efforts to implement these techniques to shrink the number of cases in which medical errors occur. The first step in any recovery is realizing the problem and forming a solution. Thank you. Illness, surgery, diabetes, multiple sclerosis, leukemia, Alzheimer's, and on I could go. The point I am making is we all have been affected some way, somehow, by a disease or even cancer, but not everyone loses their friend or loved one due to that disease. In fact, more than 10% of the U.S. death toll is directly correlated to medical errors. Thank you, and I hope you guys learned something new.